morning, afternoon, and evening, everyone, and welcome to today's pre-Congress online session titled What to Expect WSPID 2025. This is a preview of scientific highlights. My name is Alicia Chang. I'm a PID physician working in Guatemala, and an honor to be your moderator for today's event. We are delighted to have such a distinguished group of panelists with us today, representing diverse regions and specialties in pediatric infectious diseases. Whether you are a clinician, a researcher, or a healthcare professional, today's session is designed to give you a sneak peek into the exciting developments that will be discussed at WSPID 2025 in Bangkok. Over the next hour, we will be discussing key themes, innovative sessions, and global priorities in pediatric infectious diseases that will shape the WSPID 2025 program. And of course, we'll have plenty of time for your questions during our live Q&A session later. So let me first introduce our panelists. Let's start by introducing our esteemed panelists with each one of them is a leader in their field, and they will be sharing their insight on some of the most exciting topics and themes at WSPID 2025. So first, we have Daniel Jarovsky from Brazil, representing Young WSPIDs and Sleepy. So Dr. Daniel Jarovsky is a pediatric infectious diseases expert in Santa Casa de Sao Paulo School of Medical Sciences and Vice President of the Department of Immunization of the Pediatric Society in Sao Paulo, Brazil. His research focuses on immunization, pneumococcal disease, community infections, and vaccination in immunocompromised patients. He has led several studies on pediatric immunization and community infections. Daniel is a co-chair of Young WSPID and serves on the WSPID Educational Committee. So welcome, Daniel. Next, we will have Linny Phuong from Australia, representing ASID and NSPID. Dr. Linny Phuong is a pediatric infectious diseases physician in Melbourne. Linny is also a PhD candidate with the University of Melbourne and Murdoch Children's Research Institute, studying high-risk invasive pneumococcal disease. She is also involved in research in the areas of streptococcal disease, Kawasaki disease, and vaccine safety. Then we have Ifeoma Ude from Nigeria, representing the Young WSPIDs and AFSPID. Dr. Ifeoma Ude is a pediatric infectious diseases consultant at Asaba Specialist Hospital in Nigeria. She completed her residency at the University College Hospital, Ibadan, and is a fellow at the West African College of Physicians. Her clinical and research focus includes outbreak investigations, antimicrobial resistance, and neonatal sepsis. Dr. Ude has represented WSPID and Bangkok and received the WSPID 2024 research grant. She is a member of AFSP and NMA. Finally, we have Dr. Wanatpreeya Phongsamart from Thailand, representing ASPID. Dr. Wanatpreeya Phongsamart is an associate professor of pediatrics at Sirirach Hospital, Medical University, Bangkok. She specializes in streptococcal pneumonia, vaccine-preventable diseases, and antimicrobial resistance. Dr. Phongsamart founded the pneumococcal laboratory network, led studies on macrolide-resistant mycoplasma pneumonia, and launched a nationwide pneumococcal genomic study. She's active in several national and international pediatric infectious diseases committees. So we're gonna right now start with a small poll that we're gonna ask all of you to answer. We're gonna have it available in our chat, and you can answer these first two questions. First, what to expect from the WSPID 2025? So are you planning to attend the WSPID 2025 in Bangkok? Yes or no? Not sure yet. And then the second question, if you are not planning to attend the WSPID 2025 in Bangkok, what is the greatest barrier that you're finding to travel actually and be able to join the conference? So we can answer those two questions first, and then we'll discuss the answers later. And meanwhile, while you're getting those answers in, we're going to start our discussion with our panelists. So, Daniel, then let's start with you. You are involved in some very exciting sessions at the WSPID 2025, particularly in Latin America in SLIPE, joint sessions. Could you tell us a little bit more about what the sessions are and what participants can expect to take away from them?
Hi, Alicia. Thank you for your kind introduction, and I'm really happy to be here today with all of you. Let's talk a little bit of what the participation of the Latin community at WSPID 25. But before that, let's keep in mind that if you don't, you might have noticed that during the last few years, the world has suffered from severe climate change, and it's how it impacted the life worldwide, not only in Latin America. And I'm saying that because we will have one very interesting session that will address exactly this issue and how the climate change will impact infectious diseases. And of course, one of the most seen infections in Latin America from 2023 and up to 2025, definitely it's arboviruses. So arboviral infections have hit hard Latin America, specifically Brazil, last year in 2024, and it will be addressed with very deeply, let's say, during WSPID. So I can't tell much because I can't give much spoilers. Otherwise, there's no meaning of going to Bangkok. We will discuss, of course, dengue, not only the clinical aspects and epidemiological aspect of dengue and how dengue have changed during the last few years in relation with this climate change, spread of the disease to other continents that were not used to seeing dengue, such as Europe. And also we have some data to be presented at our meeting regarding the new data on the Kedenga, which is the live attenuated vaccine against dengue. They have a new data on booster doses that will be presented. It's never been presented elsewhere, so it's going to be quite interesting. And another arboviral infection that led to our attention during the last 3 years is Oropouche. Oropouche is another arboviral infection that was not heard before 2023, 2024, which has led to a high number of cases. Oropouche is a dengue-like infection, usually milder than dengue. Okay, they're quite similar but different clinical picture, but has led to difficulties in diagnostics. So it will be addressed in one of the symposium and specifically related to Latin America. And another thing that we will discuss it's in the SPID, which is the European Society of Infectious Diseases, Pediatric Infectious Diseases, and SLIPE, Latin American Society of Infectious Diseases joint symposium, would be the real-world experience of these two regions, Europe and South America, specifically Chile and Argentina, regarding the prevention of RSV infections, not only monoclonal antibodies, but also vaccination. So we're going to discuss two very different topics along the meeting that take the attention to South America and Latin America. Sorry, not only South America, Latin America as well.
Thank you, Daniel. I think those topics sound very appealing, and there are several countries still in Latin America which have not introduced yet the dengue vaccine or the RSV vaccine in pregnant women or even use monoclonals for babies. So I think this experience will be very useful for those countries that have not had any experience. And the fact that is in Latin America countries, it is very important because the population is different from other areas of the world, like North America or Europe. So I think it brings the data closer to our people. So thank you very much for giving us.
Sorry, Alicia, if I may give you just one spoiler.
Yeah.
It will be presented with more in depth during the meeting, but for the second year in a row, Chile hasn't seen a single death related to RSV in children under 2 years of age. 2 years with no deaths in children under 2. So they're gonna tell us how they managed to do it live at WSPID2025.
Oh, wonderful. Oh, I think that's beautiful data that we need to see. So thank you. Thank you very much, Daniel. So just by listening to you, definitely I think we'll have a lot of people wanting to hear about these topics, but we'll keep on going. So Linny, let's turn to you. Looks like you'll be involved in a couple of sessions. So the first session will be top paper sessions alongside Marine and Daniel. Can you tell us a little bit what sort of papers you picked?
Thank you, Alicia, and it's lovely to be here. And I'm so excited about WSPID Congress, and so I'm excited to meet all the people who are coming along as well. I can see on the call that there's 84 countries that are currently represented, which is absolutely incredible. So I can't wait to meet all of you. So back to your question though, Alicia, the top papers. So Daniel is probably smirking at me as well. We are still, I'm going to be cheeky and say we're still probably deciding, and I probably don't want to spoil the session. So there'll be some interesting topical papers. We'll make sure that we vet each other's papers and that they are relevant to pediatric ID practice. But yeah, Maureen, Daniel, and I are very excited about this session.
And you are also involved in a joint ASPID and ANSPID symposium on pneumococcal disease, which is your PhD subject. What can we expect from this session?
Yeah, so this session, again, like I'm obviously quite passionate about invasive pneumococcal disease. So we're going to be talking about Streptococcus pneumoniae. We are doing this symposium with the Asian Society, which we're quite excited about. I'll be talking initially about the epidemiology of pneumococcal disease in the region. So obviously we know that there are over 100 serotypes. We know that vaccination has changed the serotypes due to switching. So I'll talk a little bit about the serotypes that are causing disease. I'll talk about some of the vaccines that are available and the changes and how that changes the epidemiology. There'll be some cases presented by ANSPID, so the Australian trainees, as well as from ASPID, which will be amazing. And they'll all have really interesting learning points. I had a look at the 3 cases from Australia and they are incredible and very interesting cases. And then there'll be just hopefully a discussion amongst colleagues around, you know, the challenges, the lessons, and where to, given, you know, that pneumococcus is constantly evolving and vaccination schedules are constantly changing as well. So again, I think it'll be a really interesting session.
And then there's another session with maybe a possible debate between 2 experts, Professor Brian Ely from South Africa and Professor Steve Graham from Australia. Can you tell us what they will be discussing about?
Yeah, so initially, so we wanted this session to be a debate about pediatric TB. And so we thought that it would be a really good chance to talk about diagnostics. So initially, we posed the topic about smear microscopy. But obviously, as we know, a lot of places have now moved on from smears. And so hopefully, the discussion, and hopefully, we're saying this because I think we are still debating what the debate topic will be, but hopefully it'll be something around molecular testing, being the definitive solution around detection of pediatric TB, and hopefully, what that looks like across all the different settings that we work across. So again, like two experts, can't wait to hear from them. I think they'll have a lot of insights to be able to offer.
Well, that sounds wonderful, Liddy. Now let's go to Ifeoma. And your focus on antimicrobial stewardship and infection control is incredibly timely. How do you see these issues impacting pediatric infectious diseases globally? And what will your sessions be at the WSPID 2025 about this topic?
Yeah, thank you very much, Alicia. I am also looking forward to the WSPID 2025 Congress. I mean, to have experts sharing their opinions on all issues about pediatric infectious diseases. And yes, I will be participating actively in the session on antimicrobial stewardship and infection control. Antimicrobial resistance, as we know, is currently a problem. It's a global public health problem. The burden is even more on the vulnerable children in the society, because we have people who have limited access to antibiotics, and we also have very poor control of antibiotics use in certain regions across the globe. So it's going to be exciting. I have an original research article that I will be presenting in that session. We actually assessed antibiotic use in one of the tertiary hospitals in Nigeria. We assessed for the appropriateness of these antibiotics. And more importantly, we identified factors that are associated with inappropriate antibiotic use. So I think these will be important. They would serve as potential targets for antimicrobial stewardship. So aside that, this session is also going to bring to the fore the burden of antimicrobial resistance. It will highlight the importance of judicious antibiotic use. It will also bring to our focus the need for collaboration, multidisciplinary approach in managing children with antimicrobial resistance. And now we're talking about emerging infections. We have emerging pathogens with a very funny resistant profile. So we're going to highlight innovative approaches in managing children who have these infections, antimicrobial resistant infections. So it will be very exciting to hear from all the experts and also to share knowledge and learn together in this session.
Ifeoma, I think that this is a worldwide problem, and I know it is very it is very refreshing to find that we share problems, and then in a conference, then get together and try to think about ways that we can improve this horrible problem. I know in my country we do have a lot of antimicrobial resistance, and it's getting harder and harder each day to fight against these bacteria. So I am sure that from my country in Latin America, we'll have a lot of people interested in this session. So thank you very much for bringing this topic into the WSPID 2025. Wanatpreeya, let's move to you. So your work around regional priorities and tropical diseases is vital, especially for low and middle income countries. Can you share a little bit more about the interactive sessions at the WSPID 2025 and how they will focus on these critical areas?
Yeah, so good day, everyone. I'm so delighted to join with you with the pre-Congress activities today as we look ahead to WSPID in Bangkok, my home country. So in terms of tropical diseases, at WSPID 2025, you will find a highly interactive case-based session from seizures to skin to systemic collapse, a pediatric puzzle challenge. So we will present the three interesting cases from seizure with rash, a cluster of cutaneous lesions after the water festival, and a child who present with myalgia and multi-organ failure. So participants will be challenged to work through diagnosis and management together. Apart from that, dengue is another critical focus, as Daniel already mentioned. So that would be also Meet the Expert dengue session, which you will hear the perspective from the colleague from Thailand as well as from Colombia, the two highly endemic countries. And also, we are so excited to hear the very first data on a booster dose of tetravalent dengue vaccine, the Takeda in the endemic region. We are eagerly awaited for the update data for these results.
You also mentioned vaccine equity as a key theme at the WSPID 2025. Is there any session about vaccine equity in the WSPID 2025, and why do you think this is important right now, Wanatpreeya?
Yeah, so I think the theme of vaccine equity is very important and is put as a central panel of the WSPID call to action on fairer vaccine price, and this will bring together a perspective from World Health Organization, Gavi, and also the vaccine manufacturers. And the goal is to tackle barriers to vaccine access and to identify the strategy for low and middle income countries. And you cannot miss the hot topic in vaccinology symposium as well, because this symposium will explore the vaccine optimization and present the new evidence on the two-dose PCV schedule, a single dose of HPV strategies, as well as maternal immunization. So this session will move beyond science, but to look at sustainability, affordability, and the fairness, so every child benefit from the vaccine, no matter where they are born. And can I add one more session that I will be directly involved in? That's the
Of course.
Yes.
Please do.
Yeah, I need to promote my session as well. So it will be about the theme on emerging and re-emerging infections. And this is very important because the preparedness for this is a key theme throughout the Congress. And we will include the update on E. coli resistant mycoplasma pneumoniae, which is increasing worldwide and especially across Asia. And also in this re-emerging session, we'll discuss about Mpox, avian influenza H5N1, and other respiratory viruses, as well as Oropouche virus, which now we have a new finding on vertical transmission and pediatric outcomes. So you cannot miss these sessions as well.
My goodness. It is absolutely amazing. All those sessions are going to be is so interesting for the pediatric infectious disease world. So I am very, very excited about this conference, and I'm sure our audience is excited as well. So I want to thank you all for those incredible insights so far. And now we want to hear from our audience. So please feel free to type your questions into the chat, and we'll address as many as we can in the next 15 minutes or so. And then we'll hopefully have the answers for our first poll. And I believe we will have a second poll coming in soon, I believe. And so if
Alicia?
Yes.
In the meantime, while the shy people are still typing, yeah, I would like to take the opportunity to talk about the young WSPID participation during the Congress. So,
please do.
Yeah, it's a good opportunity. So, young WSPID group is, as the name already says, it's self-explainable. Young people usually under 45 have the opportunity to join a large group of young healthcare practitioners and join our discussions. There are many activities that we do during the whole year, not only at the meeting. Linny is highly involved, myself as well, and many other people make this. I believe it's a great success that we have. But during the meeting, we have. I would like to highlight one session that I love the most. Not only because it's Young WSPID, and not only because I'm involved, because it's really interesting, which is the challenging cases. So basically, we pick up some abstracts that were submitted and accepted for presentation during the meeting, and we invite the main speaker or the main author of the abstract to present the same abstract in a way as a challenging case or in a clinical case that will be addressed by young WSPID members. We will co-chair. I will co-chair the session, but the discussion will be made by two experts in pediatric infectious diseases. So I really invite you to join us. It's very fun, very important to learn from. It's very nice to see young people presenting. We learn a lot from them, and they will bring very interesting topics, not only related to Southern Asia or Latin America, but topics from the whole planet. So I really invite you to join us during that session.
I think that session sounds beautiful, and then it is interesting to have cases and then guide you, have experts to guide you through those cases. I mean, how you diagnose, how you proceed with treatment, and learn from people that actually has a lot of experience. So those sessions I think are really nice and beautiful, and sometimes you don't get to have in your specific region. Sometimes you don't get to have like in Guatemala, for example, we don't have Oropuche maybe, but you do, and so we learn from you guys from the cases you've had. So I think it's going to be a beautiful session, and I hope we do have a lot of participants in there, young and old pediatric infectious diseases. I will be there, even though I'm not considered young, but I will be there.
And 45 can join as well, because we would like to learn. I think that's the beauty of WSPID. So we learn pediatric infectious diseases from different regions of the world, and we open our perspective, and probably we prepare ourselves for the next pandemic or the global, challenges for us. So that's a beauty.
Yes. And then we become a community, right? Which is very important. And we learn through the pandemic that it is very important to have a community of persons that you can reach out to. Because health care emergencies can happen anytime. And I think it is important to have persons that you can reach out to ask questions, to get consensus about things that you need to do or not do. And it is beautiful to have a community where you feel like there is support for you. They have your back, right? So I think this is another very important thing to come to a conference, to build that community.
And I jump in and also say, Alicia, I think the other great thing about coming together as a community is learning who else is working in the same areas as you, and potentially future collaboration with research. I think that's so important. Like, none of us work in isolation. And yeah, as you mentioned, just even, pandemics and emerging diseases, like, we all learn from each other. And obviously research is stronger when we work together.
Right. Absolutely.
In the meantime, we can proceed with the results to the first poll.
Yes, please, let's do that. Okay. Are you planning to attend with WSPID 2025? 50%, yes. Yes, beautiful. The 34% that has said no, we'll see why is that. And then the 16% not sure yet. Just come. Those 16% that are saying, no, just come. If you're not sure, just come. If you're not planning to attend, what is the greatest barrier? Conflict with other events. So that's not it. Travel expenses, yeah. I know it is hard. I cannot see all the, oh, I see. I have to scroll down. Okay. Hold on. Time constraints, 20. Aha, so it's all about travel expenses, mostly. Yeah.
It's interesting to see how almost 1 in every 5 they still have visa restrictions. That's quite challenging, right?
Yeah.
So hard.
Yeah. In my country, we don't need a visa to go to Thailand, but yeah, I
We
hope to
say
one
that
day.
I'm so thrilled to welcome you all to Bangkok. We are the city that's known for warm hospitality, rich culture, and of course, we have world famous cuisine. So, would like to see you all, I mean, physically in Bangkok. So,
Yes.
I saw in the chat that Professor Kunkanya cannot turn on cannot unmute her mic.
Is that
She's
hold on.
case.
And meanwhile, we can have Mark talking about some sessions that he was interested in sharing, Constantina?
Yes.
Okay.
Yes.
Hello,
Hi.
Mark.
Yes. Hi. Hi, everybody. And thanks for the really interesting panel discussion. And I've just learned a lot about it, things that I'm also now interested in. I wanted to just mention a slight change in design from the previous WSPID, and that there are fewer parallel sessions, which I think is a great advance because one has too many options of things that you really want to attend but can't because they are happening at the same time. So this time it's a bit more streamlined. There still are lots of parallel sessions, I think usually 3 to choose from. I wanted to also draw attention to the Joint Society, Regional Society symposia, and that's also something different, that previously all of the regional societies would usually have a session representing their society only, whereas this year it's combined. Australia and New Zealand have always combined or often combined, and occasionally there's been combined meetings with WSPID, but it hasn't been the rule, it's been the exception. And this year, for example, the African Society are combining with PIDS, that's the North American Pediatric Infectious Diseases Society, and our focus is actually going to be on HIV cure. And where there's a lot of work that's going on between joint studies through the US and Africa, and it's really, really exciting, and we want to talk about that. There's the other regional societies, I'm just checking, WSPID and SLIPI are combining to talk about RSV, and getting this transcontinental viewpoint will be really interesting, how these two regions do it either the same or differently. And then ANSPID and ASPID are also combining. And it's again, dengue has been mentioned, and all the other horrible flaviviruses have been mentioned and are a real threat. So we're going to get very good perspectives on that as well. And that's all I wanted to, maybe also just to mention the research workshop will be taking place on the Tuesday before the opening session. And there are, it is open. They've already, I think, about 80 delegates who are emerging researchers who are going to participate in this very, very interesting session as well, and give people a chance to meet one another and learn a bit, a lot actually. And there will be an online possibility for that as well. And as far as I know, everything will be recorded as well. So it will be accessible later on for those who can't make it. And that's actually all I wanted to say. And just again, thank everyone for participating, and Constantina for setting it up. And also, if people have been following the chats, Bhaskar from India is a new vice chair of the education committee and will be playing a very active role in the future. So we look forward to this extension of global participation in WSPID. Thanks, everybody.
Thank you, Mark. So I'm just doing a quick review about comments in our chat. So it seems like there's one of our of the members of the audience. They want to know if we're going to be discussing in the conference the vaccine efficacy against the serotype 4 for dengue, which is rising in South India. I guess we cannot be that specific, but I'm sure it will be addressed.
Yes, it will.
And then there's one person that is concerned about opportunistic infections, and they're having a lot of challenges in diagnosis of congenital TB. So trying and looking forward to hearing about advances in diagnostics. So I'm sure we're having a session on TB. So I'm sure we're gonna listen from experts about cold diagnostics.
Alicia, we might try and sway Steve and Brian's discussion and make sure that we push in a little bit about congenital TB, and also one of the other comments in the chat was about alternative diagnostic strategies as well. So we'll try and feed them some some subliminal messages to make sure that that's covered in the debate.
Beautiful. And then I have a comment from Pulkania. Sorry she was unable to unmute from her computer. She just wants to invite everyone to join the meeting, enjoy the conference, the sharing, the learning, and the culture. The interactive session will be fun with little gifts for the fastest and most correct responders. My goodness.
That's a good one.
It will be like a game show, so entertainment. And also some souvenir from Thailand.
That sounds fun. So absolutely, we will be joining those sessions, and I'm very excited about the little gifts. All right.
We have, Alicia, sorry to interrupt. We have in the Q&A a comment from Gina Oladokun from WSPID Board and WSPID Education Committee.
Okay. Gina. Constantina,
I can read it out for you. There will be a presentation on Mpox. There will also be a focus on infections in adolescents, STIs. Adolescents are an important group of individuals that are often left out.
Great. Thank you, Gina, for that comment. I'm sorry, I was just reading, but maybe I missed that comment. So thank you so much, Gina, for letting us know. Any other comments? Do we have answers? Did we get the answers for the second poll?
No, we can actually launch it right now.
Yep. Let's do that. What is the most important factor influencing your decision to attend to WSPID 2025? Scientific program, networking opportunities, or accessibility? You can choose many of them, all of them. All right, beautiful. So we'll have the answers in a little bit. So I think that this has been a lovely session. We'll have the answers from our last poll in a few minutes. I don't know if any of our panelists want to make last few comments.
Hi, Alicia. Can I speak?
Yes, please, Ifeoma.
Okay, just to remind us that we also have interesting presentations in the poster session. The WSPID 2025 Congress offers electronic poster presentations, and we're going to share some of our very interesting original articles and some case reports. We have a case of cholera outbreak in one of the low and middle income countries. We have a case report on shock index use in children with sepsis, as well as another one on the burden of antimicrobial resistance. So let's look forward to the electronic posters as well at the Congress.
Thank you, Ifeoma. I think the poster presentations are, I mean, it's one session, it's one place that you don't want to miss. You guys are going to have several opportunities to visit the posters and interact with the authors of the posters. And as you are saying, the topics are very interesting. And then you can have a lot of opportunity for networking and also share ideas for future research. So it is one of the best places to visit in a conference in general, but in WSPID, I think it's going to be remarkable. So it's going to be super nice. So thank you for reminding us about that session, Ifeoma. All right, so we have the answers for our second poll. So it seems a lot of people wants to go because of the scientific program, but also networking opportunities, of course. And it is accessible, actually, to 30% of the people. Wonderful. All right, so I guess we will be learning a lot and interacting a lot among us. So thank you for joining us in this session. Thank you to our panelists for such an engaging discussion, and thank you all of you for joining us today. Before we close, I want to encourage all of you to register for WSPID 2025 and start planning for your participation, whether in person or virtually. It's going to be an incredible event, and we can't wait to see you there. So if you can help us to disseminate the information about the Congress and the conference, we will be very grateful to you. Don't forget to share the registration link to your colleagues and networks. So our intent is to make this truly a global event that brings together the best minds in pediatric infectious diseases. So we'll see you in Bangkok. Please take a moment to fill in the feedback survey at the end of the session. We truly value your opinion, just to see if this was helpful to you, this session was helpful to you. And really, thank you again to our panelists. Thank you to everyone for your time, your attention, and we look forward to seeing you at WSPID 2025. So we'll see you soon. Thank you.